Ngidon mentahang ni po narengi Guwahati. Hakbang iwan ban pek ya kani ka Pule ka Pius group of institutions ya kabalaseng na do usnem arajar lai. Kidon pun ki jenghikai hang ni hakbang in ilai kendo I don I professor I laap ingi. Tengin ya kendo I mentah.
Come to Pius Group of Institutions.
Thank you. Tell us about this institution.
Pius Group of Institutions is the oldest private institution, you can say of, established in the year 2003.
Right.
Then 2005 physiotherapy, we started with physiotherapy 2005 and then nursing 2006. So there are 3 different colleges under Pius Group of Institutions, which is of physiotherapy, nursing and paramedical sciences. Paramedical sciences is the youngest institution, you can say, which was established in the year 2020. Please come get
thank you. So we'll go and see.
Yeah, sure.
Right. Yakapur Banchal Group of Institutions lasdang ban itu kum gajaka bakongsan na kabenta ka jinghikai haga kot ka khia ka ba ai ga jinghikai ki bonjat lengba ki laitoli ki college bakarpang jongka kathong jongani gajaka Pule kalong ban seimaran yagi nongtrai ki batbet haga kot ka khia ban pendap ya ga jingdawa ka banang kieu hagani kaliang. Mentah, ini sedang suana kini ka College of Physiotherapy and Medical Science hakabang ini kendo dia Dr. Lopa Das. Ipada principal jongane ka college. Doctor, I see you have patients here. Are these real patients?
Yes.
So can you explain to us, Dr. Lopa, what you do exactly here in
Here
this?
actually this is a outpatient department, our College of Physiotherapy and Medical Sciences, which we have established right from the beginning we have. So we are giving service in the form of therapy treatments over here to the local patients and in and around the city. So we have almost around 10 to 15 patients per day over here. So which is usually they are taking it is we are giving it in a very nominal charges has been it's charged by the patient from the patient, and it is a learning for the students.
So what you have here, these nurses and all
These are all the students of Masters of Physiotherapy students, and one of the therapy is she is a clinical instructor of our institute.
To get a master's degree, how many semesters they have to finish? 6?
First of all, they have to complete their Bachelor of Physiotherapy program, and then that is a 4-year program, and then 6 months of internship. So from current session, from coming year, it will be around, it is a 1-year internship. So as we are under the National Commission of Allied Health Profession Act as of now, it will be starting this year. And then they have to do their masters, that is of 2 years. Based on the specialization, like they can select their specialization like orthopedic, neurological conditions, and then cardiothoracic, like that. So there are different branches. So the students choose by themselves.
And this is internship or still they are still?
This is only clinical hours, like clinical posting. We have regular clinical hours for the students.
And after this, they go for internship.
After this, they go for internship.
Okay. So all in all, they
internships are usually they go for the government hospitals in the state.
And what are the job opportunities for these nurses?
Physiotherapists, yeah. So job opportunities, I would say it's a very diverse, because there are a lot of options open for the students. Like already I said, like depending on the branches. Suppose somebody has done musculoskeletal or orthopedic, so they are having scope in case of sports. Team physios, they can take part in various sports activities like football, cricket team and all, they can be associated. Along with that, if they are like specialized in neuro, then they can join the neuro rehab centers where they can deal with lot of this stroke patients, head injury cases, spinal cord injury cases. So there are different setups. Similarly, cardiothoracic branches, they have masters of program. If they complete, they can work in ICU setups in various hospitals. So it's not only a single area. There is a diverse area where they can practice, and then they can open their own clinic also. That personal clinical setup also they can open and practice. That is right from after completion of the bachelor program.
So you offer them what they
Bachelor
call
of Physiotherapy,
Bachelor of Physiotherapy.
which is a 5 years of degree program, and then 2 years of master's program.
And placement, you have a placement, you have
Placement, we have
arrangement.
already, our alumni have been placed in various government hospitals in the state. At the same time, there are a lot of sports institutes like Abhinav Bindra's institutes also, our students have been placed. So like that there are, and they are practicing also, independent practice also students are.
Doctor, I see here that you have a kind of a lab, is it?
Yes, it's a neuropediatric lab.
Okay.
So where the neurological condition cases and the pediatric cases are treated over here. And students are also taught here for the practical training.
The technology that you use here are just practical, are they?
Yes, practical. It's like sometimes when we don't have a patient, we also teach the techniques on the normal cases, normal persons also. So during the lab classes, we use these areas.
Doctor, this is the...
This is the BPT first semester
First
classroom.
semester. Can you tell us about the class?
We have a capacity of 70 students capacity classrooms over here, all the classrooms.
Okay.
And then we have Masters of Physiotherapy, which is of like 30 students capacity classrooms over here.
This class is
This
what?
is for Bachelor of Physiotherapy.
Okay.
This is first semester.
This is their first semester.
Yeah, BPT first semester.
Oh wow, what's this, doctor?
It's a exercise therapy lab.
Yeah.
Come on.
And
This is our exercise therapy laboratory setup. So this is we have different laboratories requirements, like we have electrotherapy, exercise therapy. So this is the exercise therapy lab where we teach the exercise therapy techniques to the students, which has to be given to the patient. This is the anatomy lab.
okay, what do you do?
This is
What do
a
you
human
teach?
anatomy lab where this is the first year subject, first basic subject of physiotherapy curriculum, where the students learn about the human body anatomy. So we have, in fact, the samples are also available over here.
Oh,
The real human organs, and these are all dummies which we teach the students, and the bones, skeletons, and the real bones also we have.
these are
Real bones, yeah. Few are like dummies and
real
upstairs, and these are all real bones.
Can you tell us more about these organs?
This is actually in the real organs, we require it for the teaching their practicals. So they have to know, they identify the organs, they have to know which organs, and the major organs like heart, lungs, the liver, pancreas, these are the structures which we try to show them in which is there in the human body itself. So we have preserved these organs over here, and other things whichever is available, the real ones are the bone sets are available. The skulls are over here.
And
also
these?
here. These are also real. These are the skulls. The real skull.
These are real
clavicle,
skulls?
yes, ulna, radius. These are spine bones, the vertebrae,
These are all real.
reals.
Mentahang niya po Provincial Educational Welfare Society kadonru saka College of Nursing. Hagba mentang inilay kendo ya I Professor Bordoloy Ivan batay bnia yang ispangani ka College of Nursing kay Beidon hangni. Good morning, ma'am.
Good morning. Yes, please.
Very nice to meet you. Please tell us about your college.
Let me introduce myself.
Yes.
I'm Professor Dr. B.B. Bordoloy, the principal of CPMS College of Nursing. CPMS College of Nursing. It is under the Pule group of institution. Is one of the oldest college among the private sector colleges in Assam. And we have been running 5 nursing programs, starting from MSc Nursing, BSc Nursing, Post-Basic BSc Nursing, GNM program as well as ANM program. So Masters in Nursing is a 2 years program and we have 20 annual intake capacity. BSc Nursing, it is a 4 years degree program and we have 80 capacity. Similarly, in Post-Basic BSc Nursing, we are having 60 annual intake, as well as in GNM also 60, which is a 3 years diploma program,
Okay.
as well as ANM, which is a 2 years program of 40 intake. These are all, this is Vice Principal's room, these are faculty rooms.
Okay.
Where is?
How many faculties do you have?
We have at present 54.
Oh,
We are again in the process of recruiting some of the faculties because latest some of the few faculties they have left with better opportunities since it is a private sector college.
Right.
So therefore I think we are in the process of recruitment again.
Okay. So this is the BSc second year.
Yes.
Are we allowed to go in?
Yes. So this is 4th year BSc Nursing. At this point of time, actually our curriculum has been changed and we are in the point junction like annual system as well as semester system, both are going on.
Okay.
And this is the last batch for annual system of examination under Srimanta Shankardev University of Health Science.
Okay, and after this, do they have the opportunity of placement? Or
Of
how
course.
is it?
Nursing is a very demanding profession and abundant opportunities are there, placement opportunities are there, and not only abundant, it is diverse as well as it is consistent. So we have campus recruitment facilities by the different big group of hospitals like Max, Cloud Physicians, ICHA, and Raipur one is ICHA probably, and many more. Many more. So these are the recruitment. Otherwise also there are time to time in the state government, under the Directorate of Health Service as well as Directorate of Medical Education. So the recruitment drive is always there and they are basically will be recruited as a staff nurse in the government sectors. As well as if we talk about the central government facilities, some under central government there are like NORCET examinations are time to time there and they can be directly recruited as a nursing officer in different aims all over India. We cater students from throughout northeastern states.
Okay.
She is from Meghalaya.
Okay.
She is Professor Rikubar Arvind.
Em phía xạ nông thôn mai. Oh, lại cái Islam nè.
This is Foundation of Nursing Lab.
Okay. And madam, what do you do here? What do the students learn here?
Yes, as I told you, the nursing program itself is not just theory based, it is also a good number of hours are to be devoted for the practicals, and students need to learn the procedures that will be executed in the practical field to the real human being. So before they proceed to the real human being, actually in the simulated situation, the student need to learn the procedures. So this is the laboratory where we take care of all basic procedures. They will be starting from this lab.
Okay.
So including hand washing, starting from hand washing. Okay. So all the basic procedures, they are planned by the subject coordinators or the subject teachers, and batch by batch student in a small group in 1:10 ratio. The teachers, they demonstrate the procedure, and there will be again return demonstration of the procedure, so that student, they learn and they gain competency in that particular procedure, and that will be executed in the clinical field.
One other question I wanted to ask about the students who are average in their studies. How do you support them, and in what way do you help or guide them?
Yes, that's perfectly. It's a good question, I can say, because all fingers are not similar in their performance also. So in that way, I am proud to say that I have a very experienced as well as highly intelligent group of teachers, I can say. I have a best team of teachers with me, and we have specially a procedure which we have started, like mentoring the students. So allotment of mentors for each and every student. So it is in terms of a small group, like for one mentor will be taking care of 10 students. So not only there, and she will take care of how their performance are, whether they are the formative evaluations are going on properly or not, and if special attention is required in terms of showing some of the procedures as well as the theory portions where she is lagging behind, and that is always taken care of by the mentor. And along with, if she needs help, and definitely other teachers are always with her to help support the students. And those who get back in some of the subjects while appearing in the final examination, for them we have a provision that students are called back and arrange some special classes for them. This is one part of taking care of the weak students, as well as, again, I can assure you that there is a provision of one-to-one guidance, even by the principals. Some of the weak students, whenever my door is always I keep open, as and when they enter me, I try to find out what is your problem. She said, I am not understanding this. Even principal takes initiative to make them understand. So in that way, I think even in the clinical also, I have always a standing instruction that you need to identify the weak students, where they are lagging behind and what is their learning needs at that particular field, and definitely we identify and take care of them accordingly. One of the specialty where the graduates or the nursing students, after completion of their program, they not only that, they are learning how to deal with the community, because it is we believe that prevention is better than cure. So in that case, we need to identify what are the needs and problems of the community, not just individual patient. So individual patients are taken care of in the hospitals. Whereas if you think about in terms of prevention of those prevailing diseases in the community, definitely the family health need to be taken care of. So in that way, students learn how to approach the family, how to assess the family's needs and problems, and accordingly, by using problem-solving approach, they take care of the family's needs and problem.
That's why you have here a setup.
Yes, setup is because
based.
Community based, so that before going to the village, because some of the students, they are just hailing from the urban where multi-stories buildings are only there. So before they go to community, at least they know that this is
what the community looks like. What it looks like in the villages.
Yeah, these are some of the community health. This is we call this a home visiting bags.
Okay.
So these bags equipped with some of the simple equipments and articles, where student will carry this to the family and do some of the simple procedure, whether if it is required in the family. So this is called as home visiting bag.
So, ma'am, we're on the 5th floor. Where are we going now?
We are going to first pediatric nursing lab.
Can you tell us about this lab here?
This is our obstetrics and gynecological nursing department lab, which is preferably for the college setup. Otherwise, we go to hospital. So here we provide students regarding all the procedures which are important for this particular subject. That is labor. They have to undergo natural birth of the fetus and all. So we give them demonstration in this particular lab, but actually they do in the hospital, which we go to GMCH hospital. So this is what we have, just some procedures and as well as some pictures around here which the student has to understand what is regarding that. Then we have all the maternity, where it comes antenatal, intranatal and postnatal. In antenatal means 9 months of pregnancy. As a women, we undergo 9 months of pregnancy, in which after that intranatal means the labor, where the baby comes out, where the fetus comes out, and postnatal means that particular period where the baby has come out and it's with the mother together. And there is again a neonatal part which will be in another department again. So we consider for the mother process from the pregnancy till the birth of the child.
And this is where they get their training.
Yeah, they get a particular training here, how much ever we can give in this setup. And their actual procedure they do in the hospital, because it is very infectious, and we have to take care of the particular students also, that they do naturally. They understand the process from the correct view of the human being.
How many months does this training take?
It's a course. Nowadays they have become 6 months at semester wise. So we give in 7th semester and 8th semester this particular subject is been taught. So in 7th semester we go for the particular procedures here, and they go to the hospital for 2 months, in which they got proper hands-on training on that particular subject.
Professor, can you tell us about this lab? What is it for exactly? And you explain to us what the students do here.
This is child health nursing lab. So this is related to the child health nursing procedure only. All the nursing programs like BSc, MSc, ANM, GNM, post basic BSc, they all exposure here. All the procedure which is related to the child health nursing. So we have dummies also, especially this is our resuscitation dummy. Okay. It's a sophisticated dummy where we have neonatally, this one is neonatally, where they can practice the newborn resuscitation, which is a very essential part of the pediatric nursing. So every pediatric nurse should know how to resuscitate a newborn baby. Apart from this, we have different, this is the Ballard score, where we can assess the prematurity of the newborn baby. So we have different charts also, like management of jaundice, how we manage the jaundice when baby is born, because we have pathological jaundice also and physiological jaundice also. So this is newborn corner. Even we have a play corner also, where they can enjoy. And we have immunization schedule also. Growth chart is also there, and immunization schedule also, all the vaccines which is very essential for the newborn under 5 years of age. So every procedure which is related to the pediatric or child health nursing, they practice first here in the lab, then only they go and deal with the patient. So initial their trainings, or they demonstrated with the teachers. First teachers demonstrate them, and right after that they give the written demonstration to the teachers, so that we confirm that whether they are able to perform it with their students or not. So these things they will first learn here, and then only they will going to practice in the clinics or fields.
Ti hadin katu ka jing batay jong Dr. Lopa Das halor ka Physiotherapy and Medical Sciences. Mantang lapoy hang ni hapo ka Pius College of Paramedical Sciences hakbay Dr. Salvia Devi in Batay Shushu ayu kani ka college kadon man ay. Hello, doctor. May we come in?
Hello, please come in.
We have been around as you have introduced us to Dr. Lopa, and now we have come to you.
Please be seated.
Thank you. And perhaps you can enlighten us about what this college has to offer.
I think you would have gone through all the two colleges of College of Physiotherapy and Medical Science and CPMS College of Nursing. This area where you have come is Pius College of Paramedical Sciences, where we offer two courses. That is Bachelor of Medical Laboratory Science, which was formerly known as BSc MLT. Then another one is the Bachelor of Optometry. We don't need placement only. As soon as when they go for the internship, by that time any hospitals, any corporate sectors, they will absorb, right? For example, optometry, once they have passed out, they have 1 year internship in the 4th year.
Okay.
So the students who have gone for internship, they were already absorbed during that time only. Now they are working in Lenskart, they are working in other ophthalmic clinics and all. Like for MLT, we used to get it in private hospitals, any laboratories, or else individual laboratories. Or recently, one of my students from AIMS was selected as a laboratory technologist. Till date, we are not talking anything about placement. Like other branches, they might need placement, but for a medical field or allied health sector, for this, we don't need placement. They will be absorbed during their internship itself. Like our students are well equipped, you know, with the latest technology. You would have seen all the laboratories. We implement latest technology where it will be convenient for the students wherever they started their job. So that is one thing. Another thing is we used to take them frequently for workshops, you know, or conferences, and even for field visit, where we used to take them to. Recently, we have taken to AIMS Guwahati hospitals and as well. And for biomedical waste management in Fresh Air, we have taken. You know, and recently students of MLT have visited Manipur as well for a national conference. So we give exposure in every angle related to laboratories or related to clinics or related to academics as well.
How different is Pius institution from others?
We have well-competent faculties who are empowered with their knowledge. You know, they can deal with students. They have the capability of dealing with students, and the lab facilities is very much well equipped, and we send the students for clinical postings in semester wise basis, so they can explore other hospitals as well, or other laboratories, other clinics as well, apart from our laboratories. The message on this overall is that entering into allied and health sector as well as nursing, it's there is a guarantee for a job for them, apart from entering from other branches, because there is high demand of healthcare sector professionals everywhere, all over India as well as abroad. So it's of high demand.
Okay, doctor, thank you so much, but can you take us to the lab now, shall we?
Yeah, sure. Paramedical lab.
Paramedical lab.
Microbiology lab. There are 3 specializations in paramedical. So this is one of them. This is microbiology lab. So in microbiology, we give the students to focus and see microorganisms. Like here, I think you can see here as well the focus slides of this one, microorganisms out here, bacterias. You can see out here. It is already focused. You can go through here. You will be able to see. This you have to adjust. This one.
Yeah.
No, this one. This you have to hold.
Okay.
Then you have to, because everyone have different eye power, no? So this, if you adjust, you'll be able to see with that.
Okay, yeah, now I see.
Those are the bacterias.
Wow.
Then
Interesting.
here we do the stainings, like what we have seen out here. For this we have to do staining, where like this it will come, the slides like this, like this type slides it will come if we stain. That is which we are focusing in microscope. So here these are the staining reagents what we use, and we use for the growth of microorganisms which we grew in the laboratory. And this is the distillation unit which we can get distilled water, which we use in laboratories. These are all equipments which we use for microbiology department. This is sterilization. We use sterilization over here. We use whatever disinfectant. If we happen to throw it directly, then people will get infected. So we used to sterilize here, then we used to discard. Now let us go to microbiology, biochemistry laboratory.
Biochemistry lab.
Yes.
Okay. Let us see what you have here then.
Biochemistry and pathology laboratory.
Pathology lab. Pathology lab.
Yes.
Okay. What do you teach
These
here?
are
then?
the autoanalyzers which we use for biochemistry, no? For estimation of glucose, liver function tests, then kidney function tests, all those things it's done out here. So the manual method also we teach to the students. Like in manual, we can perform all these tests, like the Benedict's test. No, so we use burner for that. Then we use all these glasswares. You know, this is the pH meter where we can check the pH of everything. And this all are the glasswares. This is a centrifuge.
This is for the blood. Is
Yes, we have to get the serum, then blood has to be collected. Then this is where we use for collection of blood, this area. We call it as the phlebotomy area. Then we use to centrifuge it, and then either we can use the autoanalyzer, semi-autoanalyzer, or else the manual. Students does manual only. Then this area is the pathology area where we showed student how to cut the tissue for tissue cutting, all those things it's done out here. And this is the water bath.
You cut the tissue for test samples and
Test
testing.
samples. But for study purpose, we use tissues from chicken. You know, those tissues only we used to take it. These are the tissues we use. You know, we used to store it and keep. And then staining used to be done. After cutting, we used the staining. These are the staining racks. We use different types of alcohol. You can see out here 70%, 80%, you know, 90%. So such, we used to take it like that, reagents. For pathology, we have to use the original tissues, no? But then as we are using it for student purpose, alternative we use.
Where are we going now,
Now
doctor?
we are going to optometry laboratory.
Okay.
Please meet Dr. Smita, assistant
Hello.
professor.
Hello.
Hello. Nice to meet you. Can you tell us what you have here in your lab?
Yeah, so as you can see, this is our optometry lab. We have here this vision box, okay, where we will see, where we will check the patient's power, whether it's minus or plus, whether it's myopia or hyperopia, all those things we have here. And we also have this near vision chart, which you can see, okay. So for the near power, the patient will have to read it out, read all the sentences, and this is the normal power. The N6 will be the normal power for the near vision. The structures, okay, so here we can see the slit lamp. This is a telescope, a binocular telescope, okay. So here the patient will sit, here the observer will sit, and with this we can check the various eye structures, okay, inside our eyeball, the various structures. Yeah, this is the instrument.
Cái bang ila ban xem hang ni kalong bang ila ban test ya la dia kat no ke jing khlai la ni kat no ke jing bahag khmat ha ka ba ki khna school ki khna college ki ba puli hang ni ki la ban yo ya ke jing hikai kumno ba kin tip ban panon kam ye gini ki tiar hang ni po laboratory.
So can you please put
Doctor.
your chin here? Yeah, put your chin here, okay. So by this we can see all the eye structures. Yeah, even the cataract as well. The light, the light which is reflected from the retina, that also we can check. Yes.
Okay. So what do I have? Cataract?
No. I think you will have a minimal, amount of cataract, but not that huge amount of cataract. Yes.
So I do have cataract.
No. So may I ask what's your age? If like.
I'm 57.
Okay.
Almost 50.
So above 40, there's a it's normal to have, it's normal to develop a minimal amount of cataract, but not that high amount of cataract, unless you were like suffering from some trauma or something like that. This is our instrument called keratometer. The cornea, the structure, this is, suppose this is our eyeball and this is the radius, this is the curvature radius, right? So this instrument is used to measure this radius, this curvature. How much, if it is curved or if it's flat, that's we will measure by this instrument. Yes.
Okay, so this is what you teach all the students.
Yes, and
how many do you have in your batch?
So all total 25 students in optometry course. Yes.
So we offer actually both the bachelor course and the master's course. The bachelor, it is 10+2 with PCB. Minimum 50% marks is required for all the allied courses except the nursing, that diploma course is also we offer. It is in GNM course. GNM, the student from the background of arts also come, okay? And for the A&M course, direct admission is going on. This is the first criteria. And the second thing is that the students who are interested to join in our college, they need to appear one entrance. It is called as Common Entrance Examination. It is CEE. It is conducted by Shrimanta Sankardeva Health University, Government of Assam. And the notification is already declared for the BSc Nursing course, okay? And all the allied course also. It will be just started from the 20th of March to till 30th of April. The form fill up is going on in the university website www.ssuhs.co.in. Okay, and they can also for the GNM course also, the entrance will be from the 10th of April to 30th of May. And the entrance exam will be conducted on 7th of June for the BSc Nursing and all allied courses, and for the GNM it is 28th of June. Okay, and our seat is also very limited for our college the courses. We are just started the booking. The booking is going on, and in our if someone have any query and admission query, they can contact to our admission cell number. It is in 8811099994. And in our website also www.cpmse.com. Okay, they can also contact to our number also. And this is the course. And the master's course, we also offer the MSc Nursing and MPT. For the MSc Nursing, 1 year working experience is required. Okay, and for the MPT also we offer. It is also under Shrimanta Sankardeva Health University, and the nursing course is recognized by India Council, that means Indian Nursing Council and State Nursing Council. For the admission query, any enquiry, okay, they can contact to our admission cell number 8811099994. Okay, this is our admission cell number. And the second thing is the website www.cpmse.com. Okay, for this any query confusion, they need to go to our website also, and directly contact to our particular numbers, okay, in office hours, and also after 4:30 they can also, in 24 hours this number will be available, okay. And the thing is that if someone is interested, they directly come down to our college also, and the alternative is that online mode also, okay. So both the that means type, they can apply for this course, but the seat is very limited. Our booking is going on, so if anyone interested, they can come.
Thank you, madam.
Okay.
Thank you,
Thank you so much.
Thank you, doctor. Thank you. Te kumba filai I ka jingwan jongi mata shane sha ka Pius Group of Institutions ang ni Guwahati kam shimlong ka pasep ay nolol bang ilayo ka jing pliang buram nakaliang jongki lightly langut ki principal jong ini ki college ka badai ka Physiotherapy and Medical Science ka College of Nursing but ka Paramedical Sciences nakata daw kani kalong ka jingkar paru nakaliang jongi ba pinyaw wan siya kani ka college banyo ka jing kai baru banyo ka kam ka jam kani ka dai ka way na kilat ba pli na ta jong